I'm Rachel Hanson. I'm one of the paediatric specialist nurses within the team. I run the ambulatory blood pressure monitoring service, so I often have referrals internally and externally coming through to fit 24-hour blood pressure monitors. The children on dialysis have benefited from having 24-hour blood pressure monitoring. It gives us an idea of when they're not in the hospital setting what's going on with their blood pressure. As we know, a lot of blood pressures can be white coat hypertension. It's quite an old-fashioned term as white coat, as in doctors used to wear white coats. And when they'll enter a hospital setting of any sort, a clinical setting, the blood pressure will rise temporarily. So it gives us a better idea of what's going on when they're not within the hospital setting, whether that is a child that's very familiar with the hospital setting, like a dialysis patient, or a patient who just comes to clinic once every 6 months. I don't think a lot of people outside realise how blood pressure is related to kidneys. I don't think that's a common thing that people realise. I think they see that as something totally different. For me, from a dialysis patient or a patient who's got chronic kidney disease or a brand new referral who may just be hypertension and we're looking for the cause of hypertension, from the get-go really is to reduce medicating. The idea for setting up the service is that we can do this investigation before actually starting any antihypertensives. And obviously we know that renal disease causes hypertension, so the patients who have already got a diagnosis of whatever that may be, we know that one of the side effects may be hypertension, so it's important to obviously medicate that appropriately and not over-medicate. If they're very new, I think everything's quite overwhelming at that point. And even though we see blood pressure as quite a simple observation, simple task, it can be quite daunting. I think it's about familiarising yourself with the patient and what their worries are, seeing the equipment, knowing that it's okay, using it on yourself or another colleague in front of the patient to reduce those anxieties would be a starting point. Get to know their quirks, what they like, what they don't like. Being around the patients is something that I think keeps everything going and ticking and makes the job so enjoyable. But I think being part of that journey with the family at the time is also really inspiring.